So I'm going to talk today about looking at the impact of research, how that's been viewed by society and particularly government over the last 50 to 60 years. But I'm also going to talk very specifically about some of the work we've been doing and some work my colleagues and collaborators have been doing around the Research Excellence Framework. Generally speaking, in a room this large, I don't need a microphone, but if at the back you can't hear me, then wave. The other thing is that I have a nasty tendency of talking very quickly. If I'm talking too fast, wave. So if you wave, I will slow down and get louder, basically. Okay, so I come from RAND. RAND is a slightly strange organisation. We sit somewhere between consultancies and academics. Our mission is to improve public policy making through the use of research. And we attempt to achieve the kind of academic rigor that is used in academia, but our work is funded by our clients. But we also openly publish. So all of the work I talk about today is available for free download from the website. And we hope that other people will take on and use the work we do. We have offices across the world. In RAND Europe, our head office is in Cambridge, which is where I work. We also have an office in Brussels. RAND US has offices right across the States. And is a strange organisation. You may have come across it previously. It's where John Nash was based. It's featured in the Beautiful Mind movie. It's an intriguing organisation, and I will let you find out more another occasion. Now, one of the temptations when you're a researcher in this field is to talk a lot about methods, and that's not actually, I think, the most interesting thing. But if I will refer to various methods, there's much more detail on all the methods I talk about in this report. Which we did for the Association of American Medical Colleges around measuring research. That kind of has an overview of all the different methods, how they can be used, bibliometrics, logic models, peer review, data visualization, all those kind of things. So I'm going to skip fairly briefly across methods in this talk, but if you want more detail, you can download it. And obviously, I'm happy to take questions at the end. And if something makes no sense, then do ask questions during the talk, because there's not that many people, so that's probably just about capable with. So the key question becomes, or the key question I'm starting with is, why do governments care about research? Why is it something that they see as important? And I think that's because it provides, or has provided, massive benefits to society. So the area I come from, the area I tend to have done most of my work in, is biomedical science. And in that area, things like vaccines have been developed. And what I'm going to try and do is also pull examples from other areas. But as my base and most of my work is around biomedical science, I may be slightly medically focused. I hope there is enough from the other areas to keep people interested. But other things can come out from other areas. We better understand human behavior. Clearly, kind of physics and computing gave rise to the internet. Big benefits have come from research. So that also raises the question, if such great things come from research, why is government worried about supporting research? Why is it concerned about research? It's concerned because it's expensive. Basically. The target funding for research and development across Europe is set at 3%. Britain doesn't achieve that. We're about 1.7, but it's still a lot of money. If you look across the OECD nations, it's about $360 billion. So government becomes concerned that it's putting the money in and it wants to know what it gets out. And I'm going to talk through kind of three levels, I think, of what comes out of research. And the first one of those is knowledge and ideas. That's the kind of proximate outcome of research. We know more about stuff, we understand the world better. But that's not really why government and society is interested in research. Government and society is interested because it can make people's lives better. So we take those knowledge and ideas and we build them into all kinds of things. There's a kind of self-fulfilling prophecy that when we discover more, we know better questions to ask. But then taking outside that, what we're aiming for is an improved quality of life. We better understand our place inside culture and our history. We can make better policies for running society. We can, looking at the biomedical area, we develop new devices and drugs. We have better methods of delivering care. So there's a diverse range of things that come out from that knowledge and expertise. And the tendency then is to say, well, is there a common currency in which we can value those things so that we can make some comparison in terms of the amount we're investing? And that's where So that's kind of the trajectory of the talk I'm going to talk today. So I'm going to talk a little bit about what the approaches to measuring knowledge. I'm then going to go on and look at the wide diversity of benefits that come out of research and say how have people attempted to assess those, and touch on the ref at that point. And then I'm going to say, well, is it possible to bring all of those benefits together and come up with a number? The research is worth this much money. But I'm going to start back at knowledge. So the kind of initial attempts to assess knowledge tended to be based on peer review, which is a process that sort of first evolved in the 1700s through the Royal Societies in Edinburgh and in London, where they would get other people, other scientists, other experts to look at the research and say, how valuable do you think it is? How beneficial do you think it is? And that kind of carried on. And now we do peer review at a massive scale, both to assess research proposals and also to assess the outcomes of research. Peer review has the advantage, in theory, of being comprehensive, because you're actually reading the research and making a judgment, or getting people to read the research and make a judgment on how valuable it is. It has the disadvantage of being quite time-consuming, because there's a lot of research to read. And then I think there's a recurring question, I'm going to go over here so I don't block the slide from you all the time, of how objective peer review is. There have been various studies done on peer review, both at the stage of publication and at the stage of application for funding, and they show various biases within the system. So peer review at publication tends to be biased against very new ideas, because everybody in the field doesn't think they're right, because they would have come up with them if they were. And also there are instances of peer review being biased against, at application, against kind of outsiders in the field, so particularly against women or against other groups. So there are problems with peer review. And it would be nice if you could assess, it didn't take so long to assess stuff. So a number of attempts, or a number of kind of initiatives, have taken the approach of saying, well, all the papers have been peer reviewed. Why don't we just count them? I'm not saying that I would suggest this as a way of assessing research, but you can simply count the number of papers that come out. In a way, that means you can look at everything, so it's quite nice and comprehensive. It's very fast, but it's very superficial. And it makes this assumption that every paper is equivalent. And there are interesting examples where this has been done. So it was done for a research evaluation process in Australia, the Herdig system. And they said, well, we'll reward academics according to how many papers they publish. And I'm sure you can work out what happened next, but Linda Butler, who's someone I've worked with, did a very interesting piece of research to say, well, what happened at that point? And on this graph, it's slightly difficult to interpret, but this is where they introduced the collection system. And what Linda has done is said, well, if we look at the citations, we can rank the papers into the top quartile, the middle quartile, third quartile, bottom quartile. And what you find is the number of quartile 4 papers goes up quite dramatically, as does the number of quartile 3 papers. So basically what the academics did, they responded to the incentives, they published more, less significant papers. So you have to be careful, and I think this is a thing across a lot of research evaluation processes. You have to try and work out what the response will be to the system you put in to evaluate. And is that an appropriate response? It's also fair to say I think it's impossible to do it perfectly. But you can get more sophisticated. You can, rather than counting papers, you can count citations, which gets you at least slightly closer to something that is actual evidence of use and evidence of the value of the paper. An example here is which BIS did, where they said they looked at a number of the output of the UK, and they said we can assess that in various ways. If you look, we have 0.9% of the population, we have 0.3% of the global funding for research, we produce 6.4% of the papers, and we capture 11.6% of world citations. So that suggests that our papers are better than average. And we have 16%, almost 16% of the world's most highly cited papers. So you can either look and say how many citations do you get, or you can say where do you rank in terms of a kind of ladder of citation. And that's a relatively unsophisticated use of citations. If you're using bibliometrics, you should start to think about things like normalizing by field. So different fields have very different publication behavior. Mathematicians don't publish that much, they don't cite that much. Cell biologists publish an awful lot and do an awful lot of citations. So the best mathematician will have a citation level that's nowhere near the best biochemist. So the tendency is to normalize between fields. And there are also fields, if you're looking at a field like physics or biochemistry, most of the knowledge that's produced is captured through journal publication. If you're looking at a field like social sciences, that isn't as true. There's book publication. If you're looking at arts and humanities, that's very not true. So I think you have to be, bibliometrics is a useful tool, but you have to use it carefully, and you have to understand the context in which you're applying it. So that's two ways, or a kind of increasingly sophisticated way of looking at the production of knowledge. The second way I said I would look at research and what research produces is by the things you can do with the knowledge. So how do you assess the things that come out of the knowledge? As I said, there's a wide variety of different things that can come out. Any particular research project can give rise to a variety of things. And what funding agencies started to do in the kind of 70s and 80s is they started to ask the researchers to produce end of grant or even annual reports on what they'd achieved and what they'd produced. And they would collate these reports, and they would file them. And I've been to a lot of those filing cabinets. And sometimes they would do other things with them, but principally they would collate them and file them. And they're in a very interesting kind of window on the research, but they're very challenging to analyse at any scale because they tend not to be very structured. It tends to be a kind of, what did you do this year kind of question. And if someone talks about doing, running a program for engagement with school kids, that's fantastic. But if they don't, you don't know whether they didn't or whether they just didn't think the funder needed to know. So it's very much about what people think is important gets reported. So they're challenging to use because you have to read them all and it's not very structured, and you don't know how comprehensive they are. So when I started in this area sort of 10 or 11 years ago, one of the things we wanted to try and do was develop an approach that would capture the diversity of benefits of research, but would try and do it in a systematic way so that we could make some comparisons and draw some conclusions. And I worked with the Health Economics Research Group at Brunel, Professor Stephen Hannion and Professor Martin Buxton, and worked with their payback system, which is kind of built on doing systematic case studies. So we've done a number of studies like this, but we would take a series of pieces of research from 10, 15, 20 years ago, either identified through papers or through grants, and then follow those through to the present day. So where did those pieces of research go? Where did those researchers go? And we would read the papers that they produced. We would look at the research they produced. We would go and talk to the researchers about the things they'd done, where it had gone, what impact it had had. And then by looking at that across a collection of 20 or 30 case studies, we could start to identify case studies that have been successful and case studies that have been less successful, and say, are there things that the successful case studies share in common that the unsuccessful ones don't? And the most recent study we did in this area was a mental health retrospect project. So this was 18 case studies across Canada, the US, and the UK, funded by a consortium of funders, looking over 20 years. So taking mental health research from 20 years ago and saying, where did it go, what did it lead to, what did it produce? And then saying, can we identify the things about the researchers or the environment that enabled that to happen, or at least correlated with that to happen and make sense in terms of being a causal factor? One of the interesting questions, I think, in research policy is, should you fund basic research or applied research? There's a kind of continual debate about how that works. Now, what we found, now because it's biomedicine, it's clinical rather than applied, or rather, sorry, the equivalent of applied is clinical. When we went back 10 years, we found clinical research tended to have a bigger benefit. When we went back 15 years, we found clinical research tended to have a bigger benefit. And in this study, where we went back 20 to 25 years, we still found that clinical research is the stuff that's having a bigger impact on patients at the end of that time. And I think, which isn't to say that basic research doesn't have a value, but it's interesting that even on a kind of generational timescale, it appears that the clinical research is making a bigger difference to the lives of patients. We found that researchers working across disciplines, or who had experience of working across disciplines, or who were in teams that combined disciplines and approaches, were more likely to translate their research. This is kind of mode 2 production rather than mode 1, where you support people who are the absolute expert in that very narrow field. And I think this is interesting for funding agencies because the tendency is to support people who are the absolute expert rather than support people who are a little bit dilettantes do across different fields. And we found a suggestion that the motivation of the researchers was important. So people who talked to us about wanting to generate patient benefit tended to be the people who had. Now, there is clearly possibilities that that's post hoc justification, because we're asking people to look back at their careers. Maybe if you've managed to make a difference on patients, that's what you value in terms of what you've done. If you haven't managed that, but you have generated understanding, you say you were trying to do that in the first place. But that was the suggestion from the study. So the case studies we do are really quite significantly detailed, and we focus on a particular area. The ref is sort of an example of an attempt to do this type of work, but at a massive scale and for a different reason. So we're trying to understand principally what are the success factors around research. The ref is trying to understand how much impact has been had. So I'm going to talk now about the impact element of the ref, which I think is probably the largest attempt to assess research impact through a kind of case study approach, which is not dissimilar to what we do here, but at a much more, arguably more superficial level. This work was led, I'm going to talk about 3 studies around the ref impact. This first study was led by Jonathan Grant, who's now at King's, who I worked with at Rand, and he kindly has lent me the slides to show and talk about today. And it was also supported by Digital Science. So you'll all be, I assume, quite familiar with the ref. The thing that always boggles me is the scale of the operation. It's 2,000 submissions, about 200,000 outputs, 7,000 case studies. In the work we do, 20 or 30 case studies is considered a lot of case studies. And it included 57,000 staff. Now, it obviously affected more staff than that because that's only the academics. The research is divided into 36 units of assessment, as you're aware, that cover different disciplines. And for impact, for every 10 FTEs, you submit 1 case study about the impact that they've had, or the impact that's been had by the group. And it's ranked on 2 criteria: the reach, which is about how many beneficiaries there are, how widely it's spread, and the significance, the intensity of that impact. And it's important because the impact element of the ref will affect the allocation of around £1.6 billion of public spending. And I'll come back to that a bit later. So what Jonathan and the team at King's and Digital Science did was they said, what can we understand? So they had access to the full body of case studies. What can we understand about what that impact is like? How do we characterize it? So the first thing they did is they said, what can we understand about the underlying research? Now, the case studies come from units of assessment, but units of assessment aren't really fields of research. It's kind of, they align with fields of research. But the question is, did the research come from the unit of assessment which was claiming the impact? Or did it come principally from the unit of assessment which is claiming the impact? So what they did was they took another way of classifying research, which is the Australian system of fields of research, which basically has a series of categorizations that work down in specificity. So at the top level you have a physics classification, at the level below you have physics, quantum physics, and then there's actually a 6-digit classification where it's even more detailed. This is the 4-digit classification. And they said, how do we map the underlying research from each case study onto the units of assessment? So this pink up here is panel A, panel B, panel C, and panel D, which is kind of biological sciences, physical sciences and engineering, social sciences and humanities, but I can never really work out what exactly the split between panel C and panel D is. There's more arts and humanities down here than there is up here. And what they showed is that actually 2/3 of the case studies are dependent on more than one field of research. So the research which is being cited in impact case studies is multidisciplinary or interdisciplinary, which kind of chimes with the idea that if you want to have impact, you need a range of disciplines coming together. So that's where the impact flowed from. What they then did is they said, what can we understand about the types of impact that have been had? So for this, they used a text mining approach where they took the 6 million words of the impact case studies and they used topic modeling to extract topics. And the extraction is algorithmic, but the naming, you have to put names onto them. So they kind of projected onto them how they thought they were. And you can see that there are 60 topics around here, and I've pulled out a few of them. The largest topic was informing government policy. Down here, there's a topic on technology and commercialization. Animal husbandry and welfare was a small one. Public health and prevention. Cultural heritage and preservation. And what they've done here is they've said, how do the case studies span those impact areas? So topic modeling is an approach that doesn't assign each case study to a topic, you can have up to 3 topics in a particular case study, because it says it's got this collection of words describes informing government policy, and this collection of words describes technology commercialization. So you can have ones that talk about government policy around technology and commercialization. And again, what they found was that the case studies tended to have impacts that were described by more than one of these categories. So there's kind of, the case studies are not only interdisciplinary in the research they're based on, they're multi-impactful, and that they have impacts in different, or impacts can be described and classified in different ways. But there is also a tendency of certain units of assessment to have impacts in certain areas, as you would expect. So if you look at, the report has many more of these impressive figures, but I just want to show a little selection of them. If you look at water and flood management, you can see that this is where which units of assessment the impacts in water and flood management come from. So there's a little bit in biological sciences, particularly around agriculture. There's quite a lot in physics and engineering, and I think some of them written down. Yeah, so geography and the environment is this 17, which I think is around here. So that's geography and the built environment. And then down in, no, sorry, geography is the purple one. This is agriculture and earth systems and civil engineering, construction engineering, the other ones. If you look at a similar thing for impact on film and theatre, unsurprisingly, that primarily comes from arts and humanities and is spread across them. And what they did alongside mapping the kind of flow of impacts from particular units of assessment to their impact categories is they did some deep mines where they read about 1,000 of the case studies. And I thought the example I would do today is talk about today is where they looked at the film and theatre impacts. There are 139 case studies that talk about impact in film and theatre. And they selected this because they wanted something that was primarily coming from panel D, but was spread reasonably well across panel D. So it comes from a number of different units of assessment. And through reading the actual case studies themselves, they found out more about who the beneficiaries were and how those benefits kind of accrued, what process they were generated through. So the beneficiaries tended to be schools and education was 40% of them. Future practitioners in film and theatre was 60%, and then other stakeholders, which is a kind of more diverse mix, but includes the idea of using theatre and drama in the rehabilitation of offenders, and also in health settings. So there's a kind of quite a wide variety of uses that aren't enormous, but are picked up. And then their other question was, how do these benefits come about? A lot of them come about as part of an impact of the research process itself, and other ones come about in terms of the actual outputs of the research. And around 1/5 of those case studies involved participatory research. So that's kind of clearly something that's generating impact in that area. Now, if you want to know more about the detail, you should read the report, which is available from King's and Hefke. And the other thing you can do is the other element of the project was to make a digital archive of the case studies available. So you can search by impact type, by unit of assessment. You can search by if anything in particular is named, so institutions or types of impact. So if you want to see the types of impacts that have been submitted, and I think that's interesting in terms of understanding the sorts of impact that research has, but if you're doing a particular form of research, you may want to see how other people have been having impact so you can understand what the possibilities for the work you're doing is, and also maybe how to express stuff. Because I think one of the challenges around this is because it's relatively new, there's still a lot of thinking about how you best express the impact you've had and what you count. What you don't find out on this, unfortunately, is how well any particular case study was rated. So you know it was submitted, and I guess if you look at the institution and they've only got 3 and 4 star, you know it must be quite good. But Hefke has published no link between the rating of case studies and the contents of case studies. So that's a little bit about the work that King's and Digital Science have done, looking at the content of the impact. What I wanted to take a couple of minutes now to look at is the process of assessing that impact. So Rand did a couple of studies. The first one looking at the preparation of impact, so the preparation of the case studies and the impact statements, and then we did an evaluation of the assessment process itself. And one of the key questions, I think, is whether this process is worth the money. One of the reasons why impact was brought in was a concern that in the RAE, the previous system, impact wasn't valued. So if you were doing research that was making a real difference to society, but that wasn't considered academically excellent, there was no incentive really to do that. So one of the things we tried to estimate in the evaluation was what was the cost of producing impact case studies and impact templates. So templates are provided by the unit of assessment, and they talk about the story of how the unit of assessment thinks about its impact in terms of the institution. And they're slightly odd because given that the guidance was only, I think, provided about halfway through the ref period, there's a certain element of being post hoc about that. Our strategy was to do this. Was it really? So actually, I would concentrate on the case studies. The mean cost of a case study was £7,500. The mean cost of an impact template was £4,500. It was interesting that there did appear to be economies of scale. So universities that submitted large numbers of case studies appeared to be able to knock them out at a lower cost. And you can see that the difference between fewer than 100 case studies is getting on for £9,000. More than 100 case studies is down more about £5,000.
Stephen, when you say cost, what would you include in that?
So this was an attempt to get the full cost from institutions. So it includes staff time. I think it included the overheads that went with the staff. There is in the report there is a breakdown of what we asked for. It was interesting that the estimates we got were not enormously consistent because we tried to do it in both a top-down and bottom-up way. So they're kind of indicative figures, but I wouldn't want to claim they go certainly more than one significant figure. But this breaks down as 30 days to produce a case study. Now, the pilot exercises and the previous exercises that have been done, the cost is much, much lower than that. So the ref pilot was 5.1 days to produce a case study. And a similar exercise that was run in Australia, which attempted to do a similar idea using the same kind of case studies, was 3 days. I think this is driven partly, coming back to the £1.6 billion number that I saw at the beginning, there was a lot at stake. And it had never been done before. And it's very difficult to know, if you're writing an impact case study, when you've made it as good as you can. I think there was an awful lot of editing and tweaking and returning and all those kind of which built up that cost. And I don't quite know how you address that, but I think that's one of the big challenges of the process, is that there's been almost a tendency to gold plate. We'll keep polishing it until we have to submit it, and that's driven submission at high costs. The other thing which has also driven high costs is the fact that because it was retrospective, people hadn't collected the information as they went along, which meant a lot of information had to be dug out and researched rather than being more easily available. But it's quite a significant number. So that's a bit about the process of preparing for the ref. Did the actual assessment process could panels sensibly grade case studies? So we did work where we talked to panelists, we surveyed, had about 550 responses. We did focus groups. We did interviewees of another 100 or so people. And panels felt that by and large they could make reasonable judgments of the impact. They could differentiate between different levels of impact. One of the things we weren't able to do was to do an analysis of how different panel members had scored the same case studies. You would like to be able to do that, but that wasn't something that we were allowed to do by HEFKE. This is based on the perceptions of those involved. And their feeling was that the process more or less worked in terms of assessment. It was also striking that they said it had been very valuable in bringing together academics and research users, because the panels who assessed the case studies had both academics and research users involved, and they felt that process, there'd been a lot of mutual learning between the two. So the actual process of sitting on a panel, people felt, had been quite valuable. One of the challenges, which I should have said about the burden, is that the burden was also felt to have been very unevenly spread. So there tended to be a few people in the university or in a unit of assessment who did an awful lot of work, rather than it being spread across a range of people within the department or within the unit of assessment. I said earlier that one of the concerns about the RAE was that it didn't value research that had an impact. So one of the questions I think coming out of the ref becomes, has it had an effect on the sector? Has it changed the culture of the sector and potentially improved that? It does appear to be changing the culture. Institutions are clearly thinking more about impact strategy. They're dedicating posts to that, and they're implementing systems to capture that evidence so next time it's easier to find it. I think the most positive thing is that impact is now being potentially included is being included by institutions as a criteria for promotion. So the value of impact is being seen as being more important in the sector. So the last bit, or substantive bit of my talk, I'm going to talk about whether it's possible to take this diversity of benefits and collapse them down into a single metric. So rather than having to write these enormous case studies, is there a way to do it that's simpler than that? And I'm going to take an example working from biomedical science, and I'm going to say, can you generalize up? Can you take that and make it broader? So one of the big questions that came up 10 or 15 years ago, particularly around the discussion of doubling NIH's budget in the US, so NIH is the key medical research funder in the US, was what's the benefit? How much value do we get from funding medical research? And in the United States, a group called Funding First attempted to estimate the monetary return of investing dollars in biomedical research. And they chose cardiovascular disease, and they took a relatively simple approach. They said, how much less cardiovascular disease is there now than there was 25 years ago? And there was quite a lot less. And they said, how much of that benefit, how much of that improvement is due to research? And this is the slightly dodgy bit where they went, probably about a third. And how long, and how much are we funding on, how much value does that provide? Now you can monetize health benefit by effectively saying, if you live healthily for another year, how much is that worth? And there are various ways of calculating that number. In the US, it's quite a high number. The National Institute for Clinical Excellence in the UK does this approach to work out whether treatments are worthwhile, and they value another healthy year of life at about £25,000 to £30,000. So they did that. They said, this is how much benefit we've got, this is how much money we're spending on research, and the payback is around 20 times, which I think it's fair to say is probably an unfeasibly large number, and there was concern about it at the time. If the payback is that great, surely we would put more money into research. Why would we not? So we wanted to try and do a similar approach, a similar exercise, but see if we could make slightly more realistic or slightly more nuanced assumptions. So what we did was we said, we can work out how much money has been spent on research over the last 30 years, 35 years. We went to all the funders of cardiovascular research and kind of catalogued how much money they'd spent each year. We can look at the research-based therapies that have emerged. So stents, for example, which are put into your blood vessels to open them up to help with coronary heart disease, clearly are based on research. And we said, conveniently, somebody had pulled together an article that said, these are all the interventions that have used, and these are the most important ones. So we could then go and say, how many people are receiving them, what benefit are they getting from them, and we could kind of add up from the bottom to say, we think all of this benefit is due to research. So then you know how much has been spent, you know how much benefit's coming out. What remains is also the question of how long does that take? Because Funding First assumed that effectively it was steady state. You put money in, you get benefit out. Whereas in terms of research, I think it's more reasonable to say you invest in research, then a process happens and you get an impact out after some time scale. And that makes a big difference. If I give you £1 and you give me £2 back when I stop talking, that's a pretty good deal for me. If I give you £1 and you give me £2 back in 20 years' time or whatever, that's not nearly as good a deal. So we estimated that as 17 years between when you fund the research and when you get a patient benefit. And we did that looking at clinical guidelines. So we get a number of around 9% rate of return, to kind of interest rate, in terms of the health benefit produced, which is obviously strikingly lower than 20%. The other thing that we looked at was purely spending money on research generates clever people who go on and do other stuff and generates tools that other people can use. And they're called spillover benefits in economic terms. And the best estimate we could come up with for that was 30%. So the overall rate of return for spending on medical research is we estimated 39% in cardiovascular research. And we've subsequently looked at mental health research and cancer research, and the number is fairly similar, which is still a pretty good rate of return. And what we tried to do was be significantly more nuanced and make, there is inevitably, when you do these type of calculations, there are a forest of assumptions involved. but we tried to make sure we were being balanced in the way we made those assumptions. But it raises a couple of, I mean, the two biggest questions that come out of it, I think, are, do we really understand those spillover effects? Because the work that the estimates were based on was about agricultural research in the 1970s in the US, which may not be the best parallel for biomedical research in the late 2000s in the UK. And Jonathan has gone on to do some work to try and estimate that better, and that will be being published in the near future. And the other sort of key issue it raises is the time lag is really important. If you can get things from development or from research into practice faster, you can get a much better return. Now, there are reasons why you can't telescope it too far. You clearly need to do trials. You need to make sure things are safe. But that delay really reduces the benefits that you get overall. So we've gone on to do quite a bit of research to try and understand those lags and try and see where you can sensibly reduce them. Which links back to the stuff that I was talking about with REF, where when you talked about your impact in the REF, you also had to show what your underlying research was. And this graph shows where are the dates of the underlying research for the different units of assessment. Now, there is a slight artificiality in this, in that there was a 20-year cutoff. So you couldn't have stuff that was more than 20 years ago submitted. So clearly this is going to be potentially truncated. But what I was intrigued by when I saw this is I had always assumed that the kind of biological sciences area was the area where the lags were longest. And they're not actually that dissimilar between the biological sciences and the physical sciences and engineering. I mean, one of the kind of anecdotal examples is Intel's new transistors, which are just entering, I think they entered production about a year ago. They claim that had a 17-year lag from when they first invented the idea of three-dimensional transistors to when they built them. But actually, it's the arts and humanities that have the longest lags, which is not something I had anticipated. So I think there's kind of intriguing observations coming out of this. And in fact, I think this one, I can't remember which unit of assessment it is, but they had special dispensation to have a longer lag. I think that might be architecture in the built environment, but I can check that. So the lags is interesting, but what I've said, so in health, it's possible to take, just about feasible at least, to take a single form of benefit. You can collapse all the different types of health benefit into a particular type of benefit, which is more time being healthy, and you can value that. Is that feasible across the whole of research? Now, I think, I kind of feel that it's probably not, because if you see now, this is the entire alluvial diagram. So this is all the fields of research feeding into the units of assessment, feeding into the types of topics that they've had in terms of impact. The diversity of impacts is vast, even within units of assessment, even regardless of going across units of assessment. There are hundreds of paths through this diagram. In fact, I think there are thousands of paths through this diagram, which means it's going to be inordinately difficult to come up with individual metrics or metrics that are broadly applicable across the whole of research and the whole of academia. What it potentially is possible to do is to standardize some of the metrics that are used by more than one person. So people talk about audience figures when they're talking about impact, but actually the audience figures are all measured in different ways. People talk about health impacts, but even in health impacts, they're talking about health impacts in different ways. So there's definitely potential for standardizing some of the measures that are used in impact case studies. But I think the idea that impact can be reduced to simple metrics is not feasible at present, or I would say it isn't feasible at present. So that's more or less what I'm going to talk about. There's one aspect that I haven't talked about. I've talked about three types of kind of what comes out of research. The knowledge that comes out, how you use that knowledge for societal benefit, and how you can potentially collapse that to a single metric. But there's actually something else that comes out of research as well. And that's the ability to use others' research. So taking the example of biomedical research, we only do 10% of the biomedical research that's done in the world, in the UK. So, which means that 90% of the research that's done is done somewhere else, by somebody else. So there's a 1 in 10 chance that something that's important that could help the NHS or could help patients in the UK will be developed in the UK. And one of the important aspects that research provides, I think, is the ability to see what's happening across the rest of the world, contextualize it, and put it into practice in the UK. Now, how much contextualization and translation different findings need, I think probably also depends on the area. a pancreatic cancer cell in the UK is probably quite similar to a pancreatic cancer cell in the US. I suspect education research is much more difficult to translate. Research in other areas will fall in different places. But I think one of the benefits that we haven't really started to assess in terms of the benefits of research is that benefit of taking research, being aware of the cutting edge in other places and being able to bring that back and use it in the UK. Certainly in the REF, for example, you're not allowed to base your impact on research you didn't do. You have to have been involved in the underlying research, or your unit of assessment has to be involved in the underlying research. And that just kind of summarizes the idea, certainly in health, of this, is that researchers provide you with an absorptive capacity that allows you to take up the research of others more effectively, which hopefully will lead on to patient benefit. And I should just finish by saying I should acknowledge my supporters and funders, who without this work would not have been possible. Thank you very much.